Hello and welcome to this exciting programme from the European Centre for Environment and Human Health. I'm delighted to be joined by a panel of experts from the Centre whose research and specialisms range from the threats of antimicrobial resistance to the benefits of spending time in green and blue spaces. Work also includes healthy communities and sustainable food systems, as well as the impact of environment and climate change on our health and well-being. Before we move on and invite the panel to introduce themselves, I'd like to welcome the Centre's Director, Professor Laura Fleming. Laura, can you explain a little about the history of the Centre and why it exists and how the incredible team work together across disciplines and continents?
Thank you, Philippa, for this opportunity, and also to my colleagues in participating in this and all the people that aren't here, because we're actually a center of over 100 people at this point. We started back around 2011. We're actually in our 10th year anniversary. We're celebrating that with all of you. And it was funded by very generous European funding. And the idea was to have, based in Cornwall, in the University of Exeter Medical School, a center that focused on the interactions between our health and the health of the environment. And we brought a number of risk-taking researchers, professional service staff, and students, and some of them are actually on this video, and they can talk a little bit about their experience. And what we decided to do was take two sort of major approaches. One approach was to be as interdisciplinary as possible. So traditionally, people who work with numbers only work with other people who work with numbers. And people who work more around policy or the stories that people tell, that's all they do. They just stay in their discipline. And what we wanted to do was to mix that up and have different approaches, because we felt that there are huge challenges in this area and that the only way to approach them was to have different perspectives. And the other thing that we have tried to commit to is to interact with as many different communities, including businesses, as possible. And you'll hear later on some of the things that we do in those spaces.
And briefly, this session is part of Exeter University's Green Futures. And as the world faces environment and climate emergency, why is it important to engage directly with people and communities to co-create solutions?
I come from the 60s. I age myself. And I think that the slogan, think globally, act locally, is even more relevant today than it was back in the 1960s. And so I think that part of the work that we do in Cornwall and then take to other countries and to across the UK, Europe, Southeast Asia, Africa, the Caribbean, et cetera, that the lessons we've learned in Cornwall are relevant around the world. And even more so, increasingly, the lessons that we learn in those other countries from communities and peoples in other countries are relevant to bring back to Cornwall and the UK.
Thank you, Laura. So as you mentioned, it's 10 years since the European Centre was established. And to bring this to life, we've now got a short introductory film we'd like to play. So I'd now just like to briefly outline what's coming up in this programme. As the European Centre crosses so many disciplines, as Laura mentioned, and areas of work, our debate will be broken into 4 main themes: antimicrobial resistance, the importance of blue and green spaces to mental and physical health, healthy communities, looking at sustainable food systems and sensing the environment, and finally, but also really an overarching issue which influences every area, climate and environment change. Throughout the session, we'll present some examples of the European Centre's work and then invite our panel to discuss, debate and consider future solutions. So before moving on, can I ask each of you to say a few words about yourself and why the work you're doing is so important? So perhaps just looking at the screen, if we start with Amy. So just a minute to say hello, if that's all right, Amy.
Thanks, Philippa, and yeah, thanks for asking me to come along today. I'm Dr. Amy Murray. I did my PhD at the Centre, and for the last 3.5 years, I've also been doing a fellowship, and I'm going to start my lectureship this summer. So I've been around for 8 at least of those 10 years. And my work is on antimicrobial resistance in the environment, and particularly looking at how environmental pollution can lead to increased levels of antimicrobial resistance.
Thank you, that's brilliant. And we'll speak to you shortly as we'll be moving on to look at AMR. So Lewis, if I could ask you to unmute yourself for a second and just say hello.
Yep, hello, and thanks for having me on the panel as well. So I'm Lewis Elliott, and I've been involved with the Centre directly since 2016. I'm currently a lecturer in environment and public health, and my research surrounds the ways in which the natural environment can positively influence human health and well-being. And one of the reasons I think that area of research is so important is because it kind of changes the focus of regulatory bodies like the Environment Agency or the European Environment Agency to think equally about health promotion as they do health protection.
And I'll jump to the end of the line on my screen and speak to Ruth now, because your work is connected. So if you could just introduce yourself, Ruth.
Yeah, thank you. My name's Ruth Garside. I'm an associate professor in evidence synthesis. My background's in sort of social science and public health, and I'm particularly interested in understanding how we can use existing evidence and synthesize what it tells us to inform policy and practice with a more robust and complete understanding of what we know about different topics. So that means that I work across a whole range of different subject areas, both the risks like AMR and infections from recreational waters, but also potential benefits from the environment in different circumstances and for different populations.
Thank you, that's great. And we'll be speaking to you obviously in a bit more detail a little bit later. Emily, if you could join us for a second, that would be perfect.
Hi, my name's Emily Haynes. I've been a postdoctoral researcher at the Centre for the last 4 years, mainly working on nutrition-related projects. My background is as a dietitian, so I have a strong interest in how our diet impacts our health, but also in how our diets and food systems more broadly impact the environment. And I think the nutrition work that we collaborate on from the Centre has global relevance. It's really important in helping to address issues around food insecurity, rising non-communicable diseases, particularly in small island developing states where a lot of our work is focused.
That's great, and obviously we'll be hearing a little bit more about that, and you've got a presentation for us a little bit later on. And Karen, last but not least.
Hi everyone, my name is Professor Karen Morrissey, and I'm an associate professor in population health and more broadly around big data. My work overall has always focused on health inequalities, but increasingly I'm interested in the role of digital inequality. So who has access to both digital technology and things like internet, and how this may impact on their health in the future.
So Laura, if you could join us next to just explain a little bit, we've obviously heard about the work of the Centre, about your background, please.
Thanks for this opportunity, and again to all my colleagues. I'm a physician and epidemiologist. I spent a long time in the US, obviously, looking at exposures of workers in the workplace, and then gradually expanded out into the environment. And then in 2011, had this amazing opportunity to come to work with people like Mike DePlege, Emma Bland, and all the people actually that you see on the screen, and many others, to start the European Center for Environment and Human Health in the University of Exeter Medical School. And my role now, I think, is partially to try and understand all the different work that's going on, all the exciting things that you're going to hear about, but also to look for opportunities for us to collaborate, seek funding, work with different communities, different collaborators around these interactions between our health and the health of the environment. And I think this is essential because this interaction, this interface between our health and the health of the environment is really what the climate change and environmental change emergency, that's the space it has to look into, not only in terms of research, but also policy, behavior, economics, everything.
Okay, that's brilliant. And again, we'll be joining you to hear a little bit more about that later. So thank you to everyone. And as is evident, the cross-disciplinary approach is vital to all areas of work, and we'll regroup shortly for some, no doubt, stimulating debate. I'd now like to move us on to focus on the area of antimicrobial resistance. So Amy, if I could ask you to join us again, just really to set the context for us here around AMR. Why should we care about it? And we'll move on to watch a short film after you've given a little bit of explanation, which explains the importance of the world-leading work by the university in this area.
Yeah, sure. So antimicrobial resistance is when microorganisms become unable to be effectively treated with antimicrobials. So that could include, for example, bacteria, which cannot be treated effectively with antibiotics. And antimicrobial resistance is a problem because we're very reliant on antibiotics for modern medicine and increasingly for food production as well. And antimicrobial resistance is increasing quite rapidly, and there are fewer antibiotics being developed now. So we're essentially facing the potential that we could run out of effective antibiotics. So we'd be unable to treat infections.
So clearly a significant challenge, and one that the university has been spearheading. So let's watch that film, which explains some of the background.
Traditionally, really, we focused on antimicrobial resistance in the clinic, but the environment plays an important role. So you can have 1 billion bacteria per gram of sediment, and there could be 5,000 species of bacteria in that gram of sediment. But we've mostly focused on the environmental microbiome. And we use different molecular tools to understand what's going on in that very complex community of bacteria. It's not like SARS-CoV-2 and COVID-19, where it's one entity that we're talking about. So we can characterize resistance profiles within whole communities of bacteria. We also use a method called quantitative PCR. So it's the same method that's used in the diagnostic test for SARS-CoV-2 that causes COVID-19. But we use that to quantify resistance genes within populations of bacteria. So therefore, we can work out what concentration of an antibiotic actually increases the prevalence of a particular resistance gene, not in one bacterium, but in this huge, complex population. So the work we do on evolution of resistance is looking at how very low concentrations of antibiotics and other compounds actually drive evolution of resistance. Understanding of the levels of resistance in the environment helps us think about mitigation strategies to reduce those levels. So it's a real sort of change in focus from that sort of basic research, the fundamental research, into applying it and working with policymakers and stakeholders to try and actually find solutions to the problem.
So to put a little bit more detail behind this, Amy, I'd like to ask why this field of research is so important, and if you can give some examples of collaboration and working with businesses in terms of AMR and how that works in terms of your research.
Yeah, sure. So as I mentioned previously, we rely on antibiotics in particular a lot in medicine, not just to treat infections, but also to prevent infections. So they're given to immunocompromised patients, so those undergoing cancer chemotherapy or having surgery or transplants and so on. And in food production, antibiotics are used in animal husbandry in quite a lot of countries still around the world. And obviously they're incredibly important for preventing infection in livestock as well. And that's even more the case with intensive farming, where you have animals grouped closely together. So antimicrobial resistance is really a massive problem, because if we run out of antibiotics, then we risk all of these modern medical practices, and we also risk our food production. And that's increasingly important for an aging population, but also for an increasing global population.
When it comes to working and collaborating with organisations, with businesses, with public sector, can you explain why that's so vital to the work you do, and the scope of areas that you may touch on?
Yeah, so I think it's really incredibly important. So I've done a lot of work with pharmaceutical industry. So AstraZeneca has supported me since my PhD. And I think it's really good because it gives you a completely different perspective on the problem. So I know that there's a lot of research that I wouldn't have done if it hadn't have been for that collaboration. And it's also really good because they can help highlight areas in policy or regulation where your research could potentially have an impact. So I found those relationships really valuable. And yeah, increasingly we're doing work with policymakers and regulation, both at the UK, Europe and international level.
Before we come back to you and to the rest of the panel to talk about this, as an example, I'd like to explain a little bit about the Beach Bum survey. And this is where a team of researchers from the European Centre for Environment and Human Health wanted to shed light on how surfers exposed to human sewage and diffuse pollution in seawater might be affected by antibiotic-resistant bacteria. So to do this and to help them, they joined forces with the environment charity Surfers Against Sewage to recruit surfers and bodyboarders who surf at least 3 times a month. Well, not difficult in Cornwall, really, and as well as those who don't surf. And they used those participants to gather rectal swabs. So the swabs gave an insight into the microbes that are colonizing participants to build a clearer picture of how antibiotic resistance in the environment can affect people. And the findings showed that regular surfers and bodyboarders are 3 times more likely to have antibiotic-resistant E. coli in their gut than non-surfers. So I'd now like to move on to a short interview with Hugo Tagholm from Surfers Against Sewage, who engaged with the university, and he will explain the importance of that collaboration.
The collaboration means a lot to us, and I think we're very complementary, organisations, and we have very complementary approaches. Your team helps us ask the sort of bigger questions about water quality, human health, and how we can call for even more ambitious and sort of realistic interventions supported by the latest science. And that's what's important to us. Whilst we're a sort of a fun and engaging organisation, everything we do needs to be rooted in the latest data, the latest science. And if it's not, we will never have the sort of campaign successes that you've just described. And we need to make sure that we always follow that route. So we developed a really close rapport over the course of the Beach Bums survey, a pretty challenging study to sort of carry out together. I think it was a first for asking our volunteers to give rectal swabs as part of any study we've done. So in a way, the combination of really great emerging science on one of the biggest issues of our time, and quite a humorous approach at some stages, with a really active and passionate group of water users that were engaged with us for various reasons, whether they were surfers, swimmers, kayakers, or just holiday makers, was a potent combination to help drive this project together. And it was fun along the way. A few hurdles and challenges, but fun, and I'm so pleased to see the outcomes. The gearing of a campaigning organisation you know, a scientific organization always takes a bit of working to make sure they mesh and get the right things at the right time. And I think the way that we built the relationship, the way we communicated together, and the sort of closeness of the team, and even the sort of physical proximity of being around the corner from each other really helped us deliver that. There were no sort of nasty surprises. I think we addressed challenges together. There was a challenge to get the level of volunteers we had mapped out just because of the intimacy of the request, but we came together to get over those hurdles. So it was good, and actually the best projects are often always the most challenging ones. So I found it really rewarding, and I know the team did, particularly now that we see, you know, what a big impact it's had and continues to have. You know, if we looked at the successes of the 1990s, which SS was part of in cleaning up coastal water quality, I would consider that the sort of first wave of tackling sewage and water quality issues. Of course, after that investment, we're now in the sort of second wave of water quality issues on our rivers, still on our coastline, particularly with the number of people that are now using the water for recreation, not just surfers, but inland, you know, open water swimmers, wild swimmers, kayakers, stand-up paddleboarding. There's an explosion of this participation. And so our blue spaces have become even more important. The work we've done with you, the work we do through the Safer Seas service, which will become the Safer Seas and Rivers service, has really sort of helped lead the way on engaging the public with this and pushing for the next wave of investment. So we still have a lot to do on coastal water quality. We've seen record levels of political engagement thanks to our studies, thanks to the Safer Sea Service over the past 12, 18 months. And now we've got new calls. We want to see this next decade, this ocean decade, you know, really committed to delivering the next wave of progress on water quality, but also our rivers, which they're not separate from our ocean. We need to see much more action on our rivers, where we see so many problems with combined sewer overflows and diffuse pollution from farming and agriculture. So for me, I think this decade should look back to the 90s and say we want to achieve the same level of impact for our rivers and our coastline as we did in the 1990s initially. This is the second wave, and together we'll be much stronger. So collaboration will be key to solving all these issues across this key decade.
Interesting to hear from Hugo there about the importance to his organisation of the work that the university has done. But there was also a large amount of public engagement as part of that programme. And perhaps, Ruth, you could explain a little bit about that and what was involved.
Sure, thanks, Philippa. Yeah, we're very lucky to have a really engaged standing group of local Cornish residents who work with the centre on a number of different projects regularly. They're called HEPI, the Health and Environment Public Engagement Group. And they were really crucial in that beach bum study, because obviously there were a number of issues that we were unsure how the public was going to respond to in order to have a successful study, including things like a self-administered rectal swab and what kind of instructions people needed around that, what kind of reassurances we could give them about doing it. And HEPI were fantastic in looking at and discussing with us early versions of that project, thinking about what the concerns of the public might be, what kind of information we'd need to give them about how to take part safely and how to do that. And in fact, even designing a kind of cartoon instruction leaflet about how to administer the swab safely. So they were really brilliant, and we're incredibly lucky to have their input across a whole range of topics, and really skillfully managed and coordinated by our colleague Dr. Kath Maguire, who supports that group and supports public engagement with HEPI and across a whole other range of community groups for the centre.
No, thank you. That's really useful to understand, and I think it's something we'll be able to touch on as we discuss the other areas, and be interesting to see how that group influences, not just responds to, but influences the type of research that we might look into. So obviously, when it comes to AMR creating momentum in this area of work, having heard about the importance from Amy, I'd like to just discuss briefly the importance of early career research, both in terms of AMR and more broadly across the centre. So Laura, perhaps if It'd be nice to have a few words from you about how important that is.
At least for me, and I think for most of the people in the center, and actually for the university in general, we are committed to the idea that we need to grow new researchers and people with many different skills to be our future, particularly in environment and human health, because it's a relatively new area. So we need to, populate it with people who are interested and skilled in this area. So since the very beginning of the center, we've had PhDs and early career researchers, research fellows, et cetera. We've also developed a master's in environment and human health that has international and national students in it. And we also teach in undergraduate courses. We also teach so-called continuing education courses. And we interact, again, as much as possible with our community. Although in that case, I think it's definitely a bilateral discussion, not just us teaching people. So a number of the people in this particular discussion group are early career researchers, and you'll hear from them what it's like to sort of grow up intellectually in a center where you are expected to do a very interdisciplinary approach and work with very diverse communities.
I guess one of the first questions I would like to ask is, what's the urgency of this? I've understood the significance, but how urgent is this as an issue in terms of the world you're in and the research that you're doing? So perhaps if we move to Amy first.
Yeah, I think that it's, COVID, the pandemic has really highlighted, how drastic these public health concerns can be. So AMR has been likened to COVID. They've both been called pandemics, whereas COVID is sort of more a sudden sharp shock, and AMR is sort of a more slow growing, more insidious kind of problem. So yeah, I think the pandemic has really highlighted how urgent the problem of antimicrobial resistance could be, because it's been predicted that there'll be more deaths caused by AMR than there have been caused by COVID so far, but that will be every single year, as we saw in that video at the beginning.
And just to talk a little bit about sort of cross interdisciplinary work, how do you all see AMR feeding into your particular areas of work and vice versa? Sort of open to anyone, really.
Yeah, so I can talk in terms of the impact of AMR on our diets. There's a really interesting growing area of research around the microbiome, which is essentially microfauna inside our gut. So things like bacteria, microbes, that stuff. And there's some high quality research that's showing us now that these gut microbes can have a really strong impact on our health, not just physical health, but mental health as well. And some really interesting stuff about the effects of that on metabolism. And that's about how diverse our microbiome is, which is influenced by the diversity of the foods that we consume and the nutritional quality of that food. And we know that environmental conditions such as antibiotic use, and so AMR, can really play into the diversity of those gut microbes and then subsequently impact our health. So yeah, it's interesting to see the links between the two.
When I think back over my career, I was a physician in the Bronx in the 1980s. And at that time, antimicrobial resistance was totally a hospital-based issue. It was not thought to be linked with the environment at all. And what's really interesting to me, and I think the European Center with Will Gaze and Amy Murray and others in their group have really put on the map in the last 10 years, it's not really the hospital where these antimicrobial resistant organisms are growing. It's actually in the environment. And there are things that we are doing to the environment that can increase or decrease that growth. And I don't know if Amy wants to add to that, but I think it's a real change in how we see this whole issue.
Yeah, so that's my area of research in particular. So how antibiotics get into the environment and how they can cause evolution of antimicrobial resistance. It's not just antibiotics either, it's other antimicrobials. And we have PhD students who are looking at whether non-antibiotic drugs and plant protection products can also contribute to that problem.
And really to understand, how is this work that you're doing influencing public opinion, I suppose, number one, and public policy? So what changes are we seeing, and what more changes do we really need?
So we're very lucky to have very good connections with a lot of policymakers and industry. So some recent examples are the Beach Bum study was cited in the UK government 5-year AMR strategy. We've had other work cited by World Health Organization, Food and Agricultural Organization, United Nations Environment Programme. And we've also had our data shared with the European Environment Agency, and that's led to some regulatory changes on antibiotics being monitored in waters around Europe. And we've also recently engaged with the All-Party Parliamentary Group on Antibiotics, which resulted in a letter being sent to the Environment Secretary about trying to get resistance recognised in the current Environment Bill that's passing through the House of Lords.
Thanks, Amy. It's really helpful to understand that the influence and the context that you sit in. And obviously this work is ongoing given all of that. If I could just bring this part of our discussion to a close, obviously we can return to it because there are some tensions, I suppose, with some of the other areas of work. So I explain another area of focus for the centre is the benefits of blue and green spaces to human health, something that the team here I know have pioneered and championed for more than a decade. As I mentioned, clearly there is a dilemma. On the one hand, there are potential risks of being in the water. On the other hand, many proven benefits, and we'll come back to that tension shortly when we come together to discuss. But first of all, I'd like to take a look at a bit of a portfolio of the centre's work in these areas.
The sea has captured people's imaginations for millennium, all around the world. And what we're trying to do at the centre is understand the health and well-being implications of being in, around or on the sea or along the coast. I mean, it's not a new idea. In the 1750s, Dr. Richard Russell was encouraging people to go sea bathing down in Brighton, including the royal family. So he was very influential at the time for their health and well-being. Now, these ideas continued through to the 1930s when Dr. Fortescue Fox was publishing in The Lancet saying we need more research done on the potential health implications for public health of being in and around the coast. And it's only really in the last 3 or 4 years that we've resurrected these ideas from Fortescue Fox and even earlier about investigating the health and well-being effects of the coast. Well, one of the first studies we did was we looked at the census data with 48 million people in England, and we calculated the distance they lived from the coastline and also their self-reported health and well-being. And what you find is a steady proximity gradient, which means basically the closer you live to the sea, the healthier you report being. So the obvious question is, is it just richer people who tend to be healthier who live near the sea? Well, not at all. That's not what we found. In fact, what we found was the people who live in the poorest areas around the coast were the ones benefiting most. And we think that's because they spend more time there and get the benefits more. So there are many ways in which we can use our knowledge of understanding the health and well-being impacts of the coast in real healthcare settings and in public policy.
Generally speaking, when people have been designing cities for years and years, they've looked to have a little bit of green space, to bring a little bit of nature into the city or into the town. More recently, I think we've begun to understand that the particular characteristics of the green space or the natural setting may be much more important than we previously realised.
There's been a blossoming of research around green space and health and well-being in the last 10 or 20 years. We've been thinking about nature and health and well-being for a lot longer than that. Part of this project really was saying, well, okay, let's break down green space a bit more and think about, well, is it different being in an urban park to being in a forest, to being in wilderness mountain areas, to being at the coast, on the beach. All those different sorts of environments probably do different things for people. So it was all about trying to get into that relationship a bit more.
The pleasure of being able to go out into a natural setting conveniently and easily is a stress reducer. It's an opportunity to meet with friends and family in a pleasant setting. These are the kind of quality of life measures that are desperately important to people. And I think in the future we'll see much more of a rebalancing between economic worth of a particular environmental asset compared with the non-economic value of access to nature and contact with nature.
If the evidence that we're producing does show that there is an association between the environment in which we're living and our health, I think that's quite interesting and quite a fundamentally important thing for us to know and to demonstrate that we need to think about the state of our environment. This kind of research just contributes us to highlighting the value of the environment for us all and trying to encourage everybody to have that opportunity to benefit from it.
Before we move on, I'd now like to share a BBC News report focused on the work of PhD researcher Alex Smalley and his Virtual Nature Project.
Now, a study is getting underway today to help scientists understand the benefits of nature and whether it can be brought into people's homes digitally. The Virtual Nature experiment is being run by the University of Exeter in collaboration with the BBC with the aim of improving the well-being of those who struggle to get outside. Well, let's speak to PhD researcher Alex Smalley now, who's leading this whole project at Exeter University. Thanks so much for joining us. Obviously, some people, if they're older, they perhaps can't walk very far. Many other reasons why people can't get outdoors as much as they want to. Is there any evidence that if you watch pictures of, the natural world on a screen, that helps you calm down or feel happier? Is there any actual evidence on that?
Yes, you're right. We have 40 years of research which shows that spending time in nature can be good for people's health and well-being. And a large part of this actually comes from laboratory research, which has used these digital proxies of nature, things like videos, photographs, soundscapes, to understand how people respond to nature when they're out in the real world. What we haven't really been very good at doing up until this point is viewing the virtual experiences of nature as therapeutic encounters in their own right. So that's really what we're hoping to focus on in this experiment.
Okay, following that slice of the European Centre's work in the area of blue and green spaces and the benefits to our health, I'd like to invite Ruth and Lewis to join us now, just to give really a little bit more of an overview of the work in this area and really why it matters. So perhaps if we could start with you, Ruth.
Thanks, Philippa. Yeah, I think as Laura was saying earlier, traditionally, environmental health, thinking about connections between environment and health, really focused on risk and things like air pollution or water pollution impacts on the various different human health conditions of that. And one of the things that the Centre is really proud of is that we feel that we've contributed to a kind of paradigm shift where we're also now looking at what the benefits are of being engaged with the environment. And that's really been helped by the Centre's commitment to multidisciplinary working and also to a range of different methodologies. So, we've got microbiologists like Amy, but we've also got psychologists, sociologists, public health people, people who are using qualitative methods, people who are using quantitative methods, and a whole range of different research ways of trying to understand how and why and to what extent connection with the environment, whether that's green spaces or blue spaces, can have a positive benefit on human health. And so there's been a number of really important ways that we're thinking about this, trying to understand the scale of benefits. So thinking about how much outdoor physical activity, for example, might contribute to health benefits in the UK as a whole. And there was a collaboration with Public Health England and Natural England, which showed that outdoor physical activity delivers an estimated £2.2 billion worth of benefits to adults in England each year. And so that's really important to start being able to quantify and to talk to policymakers and practitioners about what the potential benefits might be. Other analyses have tried to assess how much contact we need to gain a benefit. And it's been estimated that we need something like 120 minutes a week for outdoor activity to deliver health gains. And obviously that also speaks to Public Health England, who've previously said a similar scale of amount of physical activity is required, 150 minutes a week, to gain health benefits. for individuals. And these studies and other studies have also helped to develop things like practical tools for local authorities, like the Greenkeeper tool, which helps them to think about how they can maximise the health benefit from investment in local green spaces for their populations.
Lewis, just to ask, when it comes to the decision makers and policy and shaping the direction of policy, where does this, I wouldn't say issue, but this area of work sit now in terms of that public consciousness and political consciousness? And are you pushing at open doors, I guess is the question.
Well, I suppose from a public health perspective, you know, if you imagine the natural environment was a pill, for example, it provides a space for physical activity. It has the ability to improve our physical health, our mental health, potentially our social ties and social cohesion. And on top of all that, you know, it can also mitigate against air pollution, noise pollution, and various climate change related issues. You know, if you were to imagine that was a pill you would definitely take, I think, because it provides all that kind of myriad benefits. I suppose we're trying to push this into the public consciousness by creating various decision support tools. So Ruth already mentioned one. We've also created a similar one for blue spaces. So that was co-developed with the World Health Organization. So it allows planners, for example, to assess all the risks and benefits from a particular aquatic environment and come to an informed decision about the kinds of changes you might want to make to those kinds of environments. So I suppose, I mean, something we haven't mentioned on this call yet is our sort of collaboration with the World Health Organization as a collaborating center for natural environments and health. And I think that's really allowed us to kind of push some of this research into policy-making arenas.
And when it comes to, I suppose, the past decade and the awareness, you know, the centre's sort of foundations were built around this type of work. What change has happened, and Nora, you might be able to feed into this in terms of what it was thought about 10 years ago and how it's being perceived now?
I mean, I suppose, yeah, I mean, you know, around 10 years ago now, one of our colleagues, Ben Wheeler, published a paper about living near the coast and how it can be important for good health and well-being. And I think, you know, that piece of research in particular, it really changed the focus in terms of thinking not of natural environments as just one big thing, but starting to pick apart different kinds of environments, different qualities of environments, and how all those things might combine to sort of positively impact public health. I mean, nowadays, you know, I don't see a research paper that doesn't try to consider green and blue spaces as distinct health promoting kind of resources. And as I kind of mentioned at the beginning, I think throughout the kind of course of our research, both on blue and green spaces, it's kind of changed the roles of organizations like the Environment Agency to not look at, for example, just how you prevent flooding, for example, but also to see rivers as a kind of health promoting resource. And, you know, so I guess all of the research that we've done has kind of tried to change that perception within those kinds of bodies. I mean, you know, we've seen it with DEFRA too now. You know, an environment, farming and rural affairs, you know, body is now interested in social prescribing of green spaces for health. You know, similarly with the Natural Environment Research Council, which is one of the UK's research councils, they're now much more interested in interdisciplinary approaches to an environment and health than they used to be. Of course, not all of that is a direct result of our work, but our work has certainly been a large sort of influence on changing the conversation around those things.
I think Ruth can add some stuff on social prescribing, and I'll back off in just a sec, particularly since the NHS, the National Health Service, has really embraced that. But I guess another piece that was mentioned earlier also by Ruth is the whole issue of equity of access. And it's equity of access to healthy environments. And then my own personal concern, I think that of many others, is that we don't love the natural environment to death. We also need to take into account the health of the natural environment. And the last piece for me has been a realization that in highly industrialized countries, there's access to blue and green spaces. It's variable by socioeconomic class, but there is an understanding and support for that. but increasingly our work is moving into other countries. For example, in a project called Blue Communities, we're working in Southeast Asia with people who live in and around marine protected areas. And I think it's really important to understand the relationship of all different types of populations with their natural environments, in my case, particularly blue environments around the world. And I don't know if Ruth or Karen want to add to that.
Yeah, so I think that's right, you know, that we are doing what you said at the beginning, Laura, in terms of thinking globally and acting locally. And we're also doing some projects which are trying to both think and act at a global level, trying to understand the similarities and differences in the way that coastal communities benefit from and are challenged by their coastal and ocean areas that they're linked to. So the Blue Communities project, as you mentioned, looking at connections between coastal community health and marine protected areas in particular, but you know, ocean areas generally, and also doing that at a European level through the SOPHI project, Seas, Oceans and Public Health in Europe, thinking about what opportunities there are for gaining benefit from coastal resources, but also how they need to be protected and how they need to be managed into the future, and thinking about what kinds of research is going to be useful in our changing environment with environmental change and climate change happening to such a great extent. And also just picking up on Lewis's point about how the work that the Centre has done has helped to inform and change the dialogue at a policy level. I think what we would really like to see would be the environment to be considered in almost all health policies, whether that's about how you dispose of pharmaceuticals or how you try and reduce waste in the health service, or how you might use the environment as a positive agent for change in different population groups, but also starting to see health being considered in all environmental policies as well. And that DEFRA's 25-year plan for the environment is a really good example of that, where work that we did, and in particular our colleague Dr. Becca Lovell, working with DEFRA and the Centre and PHE to synthesize existing evidence to inform that report and ensure that health was a key theme that was considered within it. As Lewis said, one of the things that's come out of that is a really big investment for a cross-departmental project, thinking about the potential of green social prescribing for people with a range of mental health conditions, as well as loneliness or social isolation, and to really try and work together to think about how that can be embedded and scaled up across different localities in the UK. And myself and Dr. Becca Lovell and Karen Husk and Harriet Hunt are involved in an evaluation of those 7 test and learn sites that have been established. We're right at the beginning of that, so we're really excited to be working with that group, and we're in collaboration with the universities of Sheffield and Sheffield Hallam to try and understand what systems things need to be in place to allow that kind of big interdisciplinary, multi-service, multi-system activity to be successful, to allow the people who need the benefits from the natural environment to be able to access them. And as Laura said, one of the key concerns is to try and ensure that populations who perhaps haven't traditionally associated themselves with accessing green spaces, or haven't been able to, or have experienced barriers to accessing it, that those people can be supported to get the benefits from the natural environment as well.
Thank you, Ruth. And just lastly, to sort of circle back to what we were talking about earlier, from I guess a superficial point of view, on the one hand, I'm hearing AMR dangers of going into the water, on the other hand, blue space benefits of going into the water. As a department, how do we reconcile that tension, or do we even need to?
Well, I think, yeah, I mean, one of the interesting things for me is, you know, I'm a psychologist by background, so I'm interested in how we change people's behavior. And so some of the work that I've been doing at this centre, based in psychological theories, looks at how best to promote access to these environments across different demographic subgroups. So we're trying to encourage more visits to coastal spaces, for example, through some of the work that I'm involved in. At the same time, I'm also involved in a current application to the Joint Programming Initiative on Antimicrobial Resistance, which looks at interventions to reduce transmission of antimicrobial resistance, essentially evaluating interventions that try to get people away from the water as much as possible. So, I mean, I don't think there's many other centres, in the world where I'd be able to work on two completely opposing projects like that. So I think it is important to reconcile and to recognise the risks and the benefits and to evaluate interventions that do both. But I think the importance of, trying to harmonise across those two kinds of interventions, which I mentioned, is the importance of access to safe waters and safely accessing waters in a sustainable way. So, as Laura mentioned, it's not just about everybody go to the natural environment, because that's not going to be a sustainable solution in the longer term. It's about recognising and supporting access in safe and sustainable ways.
And I'd like to move us on to another broad area of research, healthy and sustainable communities. And when I say broad, I mean broad in terms of the coverage and scope of work. And as part of this section of the programme, we're going to focus on sustainable food systems and also digital inclusion. So this is an area that covers so many elements, and we can touch on a couple here. So firstly, sustainable food systems are something that many of us take for granted, but for small island developing states, there are high burdens of malnutrition. And over the past 3 decades, this has been exacerbated by an increasing reliance on food imports, the majority of which are of low nutritional quality. So before coming back to you, Emily, to discuss more broadly as a panel, I'd like to move to a presentation that you've kindly prepared, which looks at one of the particular projects that the Centre's been focused on.
The last few decades, our globalised food system has instigated a nutrition transition, a shift away from access to healthy fresh produce and increasing availability of ultra-processed foods. Not only is this shift affecting our health, with many countries burdened by the increasing prevalence of diseases that are a result of poor diet, but this globalised food system is also affecting our environment and is a key driver of climate change. These impacts are particularly apparent in small island developing states, the majority of which are found in the Caribbean and Pacific regions, and are countries that are disproportionately impacted by the links between climate change and health, one of which is the food system. As a result, there is a growing interest globally in the value of local food, promoting local food production for local consumption, shortening food value chains, and monitoring the impact of these efforts on our health and the environment. Over the last 5 years, we have collaborated on research from the Centre that has focused on this concept of local food, particularly in 2 small island states as case studies, Fiji in the Pacific and St. Vincent and the Grenadines in the Caribbean. As part of these projects, we have worked with regional academic organisations, non-government organisations and governments to develop methods and tools for evaluating community interventions. Our pilot work in these islands indicated that there may be a link between how and where people source their food and the quality or diversity of their diets. So now we're working on evaluating existing interventions in these regions that focus on a local food approach. An example is our partnership with the University of the South Pacific. Billy here on the left is from their Centre for Environment and Sustainable Development. And then Sashi on the right is the director of a local NGO, Friend, who have years of experience in running interventions. And they provide education, skills and resources for building and maintaining backyard gardens to improve household nutrition. The intervention run by Friend is the 9x9 Backyard Garden Initiative, which means setting up a garden to grow 9 types of 9 varieties of food.
So here are examples of 2 varieties they grow, say roots and fruits, but they'd also include 9 varieties of leafy green veg and herbs, for example. And this aims to increase diversity in what households can grow and subsequently diversity in the diet they feed to their family. So we aim to use our co-developed and context-relevant tools to evaluate the impact of this intervention on diet and health. In a broad sense, our work aims to help communities towards resilience to climate change and to their food systems for better nutrition and health. And our partners have strong links with local governments and work hard to influence policy change. So truly collaborative work that's providing important evidence for change. These partnerships between the University of Exeter and international institutions and the evidence that we produce as a result would just not be achievable without the support from the European Centre.
So thank you for the presentation, Emily, and we'll obviously want to chat with you more now. So really, if I can come to Karen at this point to talk about the importance of working with local communities, engaging with stakeholders, be it within this project or any other project. How does that work and how significant is it to the work that you're doing?
So all of my research, regardless of what topic I'm looking at, involves working at the local level with communities. If you are hoping to make change, it's not enough to engage an individuals one by one. You actually have to engage at a community level. We're very social beings, and I guess that's been even more highlighted by the current pandemic. So to actually there's a lot of research showing that to enact any kind of important societal change, we have to target all aspects of our communities, not just one part or another.
And with regard to the projects that you have described, Emily, what were the challenges involved in that and the opportunities, and what scope of future work can come from that project?
Yeah, I think in terms of opportunities, it's been great to work with or collaborate with organisations locally, like academic organisations, as well as non-government organisations in these different regions. So specifically in Fiji in the Pacific, and in St. Vincent and the Grenadines and Barbados in the Caribbean. And those collaborations have actually been essential to the work that we've been doing. We would not have been able to develop that work without particularly the non-government organisations. We have co-designed tools, which I spoke about in the presentation, with these non-government organisations for evaluating the impact of food sources. So where or how someone sources their food on diet quality. So for that, context relevance is essential. And the individuals and organisations that we've worked with have allowed us to do that. But in terms of barriers, particularly in the last year, the projects we've worked on in the last year, I think the vulnerability of these regions to natural disasters has really played out as a barrier to some of this work. We know that these small island states are increasingly vulnerable to shocks. They're associated with climate change, like extreme weather. And just over the last few months, we've worked with our Fiji team who have suffered with multiple cyclones. St. Vincent in the Grenadines has seen the eruption of the volcano that's had devastating impacts on food production, impacts that we can't really fully understand yet, but on food production, food security, livelihoods, and obviously the impacts of COVID on all of that. So in order to overcome those challenges, our thoughts are with our partners at that time, but we're trying to reshape our research to address the real need in the area now. And that's something that we're collaborating with our partners on. And it's those close partnerships that enable us to do that and hopefully help them to overcome some of those challenges that they face.
I wanted to add something. So the Southeast Asian partners that we've been working with through the pandemic in the Blue Communities Project, ironically, some of their public health systems are much more robust than some of the more developed nations, such as my own country, the US. And several of them have been able to work throughout the pandemic with normal life, despite the presence of COVID, because their public health systems have been so good at dealing with it. So again, I think this also raises the thing of how we can learn from our international partners and bring that learning back to the UK, to Cornwall, and to others.
It's interesting what you're talking about, I guess, is a responsiveness, and I understand that research projects as a project may take many years, but how live, and this is a question to everyone, how live do you need to be in the context of the times to adapt?
Yeah, and these communities are basically, they are always adapting and evolving. And I just want to highlight also Laura's point about having learned so much from these communities. So whilst in the West, we understood the importance of local communities, as I said, in enacting change, but we did nothing with that. We didn't engage them properly. However, over the last few years, I've learned so much about how to engage with local people on the ground to ensure that actually science is, it matters to them and is actually playing out in real life. So it's been, the knowledge exchange has been absolutely both ways.
And really talking about that, you're referring, I think, in some of the work that you're doing to a project in this country, in the UK. And as we've mentioned, the work spans across the globe, but a particular focus here is around sensing the environment through projects such as SmartLine. So if I can move us on, it sounds like a big jump to digital inclusion from sustainable food, but actually the emphasis in terms of that engagement is completely aligned. So Karen, if I could ask you a little bit about SmartLine, just to outline what that project is about, and then we can have a little bit of a discussion around the findings and the influences sitting behind that.
And I really focused on how SmartLine is used to understand the health impacts of our home environment. And if, once again, I bring up COVID, because if nothing but the last 15 months have shown us anything, it's the importance of our indoor environment on our actual health and well-being. So at various points over this very lengthy period of time, not only have we had to spend all our time in our own homes, but also we've had to, many of the activities that we take for granted that constitute making us a healthy person, a healthy household, a healthy community, they all had to be moved online. We were doing our shopping. I did an optician's appointment online. We were going to school online. We were working online. And this was great for those of us who can actually access online, access those activities online. And when I speak about access, I don't mean just about having broadband or having the digital technology. I'm speaking about the actual capacity to use these and the capability, and really importantly, the confidence to do your online shopping and not worry about being scammed. So actually, what I argue, I have been arguing over the last few months, is that in response to the pandemic, digital inclusion has become what was once seen as kind of a peripheral health care area, maybe around telemedicine, accessing doctors in rural areas, is actually now a key public health concern in creating sustainable, healthy communities.
And how would you say SmartLine as a program, as a project, and that's the title of it, has demonstrated that?
So a lot of our learning in SmartLine has been very difficult, in that when you work with communities, feel like you're taking loads of steps forwards and then back and forward. So very iterative, because we are reaching out to our participants all the time. So
just to ask quickly, what did you actually physically need to do? What was the infrastructure that was put into people's homes?
So actually, at one point, people, are very benevolent participants, have allowed us to put in 8 different environmental monitors into their home, and we're collecting data from everything from water and electricity to humidity to air quality, so we can actually see how people's indoor environment is impacting perhaps on the respiratory health. But also we gave them access to tablets with SIM cards so that they would be able to engage with online technology. And that is where our learning came from. It's not just about the infrastructure, that you really have to engage people in being confident and capable around online technology. It's not about giving out iPads or iPhones. It's about developing a more nuanced approach to digital inclusion.
And so in terms of that project and the findings, are you at a point of influencing policy or shaping, changing local authority provision? Where are you at in terms of those findings?
So absolutely, if at this moment in time, actually, we have people like Public Health England and numerous councils across the country actively coming to us to understand how online technology, online activity, as well as digital technology can actually be used to ensure that we are living healthy lives. I think one of the main findings that we found is that, perversely, that if we don't address digital inclusion, we're going to compound current health inequalities. Getting people online is no longer an optional extra or a nice luxury good. Actually, having access to online capacity is as much a basic right as water, access to water and electricity.
Okay, so thank you, Karen. I'd like to end this segment really on a point of reflection and to really show how, as a centre, we've been working with SMEs, with local businesses, particularly around points of social inclusion and inclusion in areas of connecting with blue and green spaces and using digital technology to enable that inclusion. So really it summarises how this cross-disciplinary work comes together. And this piece looks at some work we've done with Access Lizard Adventure and an SME called Foam to help visually impaired people have access and improved access to those environments.
We did an in-residence application with Smartline, and that allowed us to work with an organisation called Foam to help them develop the technology and help to test that technology in the initial stages. And then the next step of funding was developing it even further, ironing out all the technical difficulties and testing it with visually impaired users. And it's allowed us to have this lovely open event today where we've got a nice group of visually impaired people to go kayaking, and several of them have never been kayaking before.
So Smartline has enabled all of this to happen. Without them, we wouldn't have had the connections. So part of the project is that they put us together with the technology developers. So they'd originally developed this to be used on a bike. And when Smartline told us about it, we was like, why can't it be used on a kayak? And if we used it on a kayak, if we put sounds on a kayak, there's a whole different user group that kayaking could be opened up to, and that's the guys with visual impairments. And even those who are totally blind don't need that sense to come out on a kayak. If they can hear sounds, they can use it for orientation, they can use it to explore the nature, and they can use it to give themselves a bit of mental health and well-being.
Okay, my visual impairment is actually physical damage to the eyes. Basically, I had a brain tumour when I was 3, which basically crushed the optic nerves in the back of my eyes. So I have no sight whatsoever in my right eye and only 10% left in my left eye. I haven't done kayaking before, well, once when I was in secondary school, but with a group of people. With this experience, I had the confidence to go out there with the tactile maps and the sonic, the sonar canoes. It gave you a general idea of what shape the lake was, which zones you were entering and how to basically pilot around it. feel confident enough that I could probably do it by myself at this point, which is something I never thought I'd have as a visually impaired person.
So Smartline have allowed us to develop this project in a completely different direction to how we were before, and working with completely different groups of people. So that actually the whole water sports angle with the sonic kayaking, we hadn't really explored before. So that was really good for that.
I was able to be a bit, independent out on the water, which again is what this project is kind of all about, because you're using technology to enable disabled people to go boating effectively.
I found it very interesting, and I found it very peaceful and a lot of freedom. When you're on the lake, it's with the atmosphere of the poetry and the music and listening to all the sounds around as well. It was just very atmospheric, and it's nice if you've got visual impairment, because sometimes you don't get much freedom, and I found that very good.
So I think the main impact of this project has been bringing together the companies, the different people involved, and all the kind of ideas that come out of that we wouldn't have had otherwise. So we're already talking a lot about things we could do in the future, and making the sounds in a different way and using the system differently. So it just starts all those kinds of conversations going.
It has the potential to go in other things like paddle boards, and gig rowing and stuff like that. There is no end of where this can go, and I can't wait to see how this progresses. And I hope to come and trial some more, because again, that feeling of being out in the water on your own in a solo boat, just following all the sounds, it was brilliant. That is what it's all about, is independence, and this is what it's going to give people.
So moving from that local example back to a more global picture of the climate and environment emergency, which clearly impacts across all of the areas under discussion today. And I'd like to turn our conversation towards this now. Firstly, one of the European Centre for Environment and Human Health founders, Professor Mike DePledge, explains why we need to change the conversation and the rhetoric, and to rethink our ways of living.
And how do we get our leaders to think differently about this? The rhetoric on nearly every TV show and in the newspapers is politicians talking about economic growth that will make us more prosperous and deliver happier, healthier lives to us. But we know that just having money in our pockets is not the only thing that makes you happy. There are environmental consequences to adopting Western lifestyles, and we know that Western lifestyles are not just prevalent in Europe and America, but also now in South America and in China and in other parts of the world. What are these consequences? Well, most of it hangs around energy use, and we know that we've gone after fossil fuels in a major way and liberated very large amounts of carbon dioxide and other gases, methane, into the atmosphere, and that this has generated global warming and climate change. The oceans have warmed, and there'll be sea level rise, and we expect that in the future there'll be more severe storms, there'll be floods, there'll be heat waves, and indeed we're already seeing some of those things now. Scientists have been warning about them for 20 years, and now we see them in increasing frequency, and we will see much more of it in the future. They'll have an impact on our lives. But if we could perform magic and make climate change go away, do you think the world would be okay? Well, clearly it wouldn't be, because the other threats that we face are things like biodiversity loss, destroying habitats around the world so that we're losing many of the important species of animals and plants. We're wrecking and destroying vital components of ecosystems around the world. And then as we go after the natural resources, the metals, the other chemicals that we need to make devices, like the mobile phones and like the computers, then we're causing even more damage, and we're also liberating environmental contaminants into the world. They contaminate our food and air supplies, our drinking water, and they accumulate in our bodies. And there's growing evidence now that environmental chemicals, the body burdens of chemicals that we accumulate, are changing patterns of disease on global scales.
So given this global picture of an environment and climate emergency and the impact potentially that our Western lifestyles are having on that, where do you feel the solutions lie, and how does our research offer some answers? Perhaps if I start with you, Karen.
So as somebody that has started to really work in the area of digital technology and human health, I would like to start by saying I do not think digital technology is going to solve all our problems. We are not going to be able to engineer our way out of this, but certainly we can start to use digital technology to start to mitigate and adapt our lives around climate change. So for example, we're already seeing digital technology infrastructure being used in Africa to give warnings of particularly heavy showers of rain, etc. So digital technology has a huge role in playing given our climate challenges, but it is not the answer in itself.
Perhaps if I could prompt to Lewis in terms of any thoughts you may have around that question about solutions and the weighing up, I suppose, of risk with solution.
Yeah, so I mean, one of the sort of findings that I wanted to draw on in response to that was part of our pan-European collaboration called Blue Health, which was a nine-partner collaboration across Europe. One of the findings from that was that even just visiting aquatic environments is worth around 631 billion euros to around 80% of the population of the EU every year. But that actually drops by over 100 billion euros for every 1 point reduction in water quality. So I think one of the key messages there is just how important a healthy environment is, not just to our health, but to our economy as well. And, you know, I think economically speaking, one of the ideas that's being floated around contemporarily at the minute is this idea of a green recovery from the current pandemic. You know, that means investment in green industries, for example, as a solution to the kind of inevitable economic consequences that are going to arise. And, you know, I suppose as an indirect relationship with our work is to lobby for ideas like that, you know, ideas like a green recovery from these tragic events. So I suppose that's one of the solutions I would offer.
And Amy, your thoughts in this area in terms of how research can play into some of those answers?
So from the antimicrobial resistance side, I think the overlap with climate change is sort of a new research area. So there's not been much done on that at the moment. But, you know, if you think about climate change, you think about changes in precipitation and changes in temperature. So in terms of resistance, if you have increased flooding, for example, in the UK, we have a combined sewer system, meaning that our sewage is mixed with rainwater. And when that system gets too full, then you end up with combined sewer overflows. So you're getting direct discharge of sewage into the environment. So that's one aspect. The other aspect is if you have reduced precipitation, then you'll have less dilution of, say, antibiotics and antimicrobials that would end up in the environment. So that could be even a greater issue in low to middle income countries where you tend to have most production of these compounds. And then in terms of temperature, there's been some evidence to suggest that increased temperature could lead to increased antimicrobial resistance. And we have a PhD student who's working on that currently, so really trying to explore the influence of temperature on levels of resistance in bacterial communities.
And Emily, you spoke earlier about the direct experience for some of the participants in your research and the collaborators of the immediate effects of climate change. Do you have any thoughts to add to this area in terms of where are the answers and how can our research adapt and feed into those? Maybe you could expand on that point a little.
Yeah, so we know that climate change is impacting our food system in various ways that impact biodiversity, and then subsequently the diversity of our food that's produced within those environments, and then the nutritional quality of that food, so the nutritional adequacy of our diets. And we know that these natural disasters, as I mentioned before, that we're seeing in small island states are impacting their capacity to produce healthy, nutritious foods, which undermines food sovereignty. So I think one way that we hope to contribute to solutions through our research is by building evidence that focuses on localizing food systems, so localized resilient food systems. And hopefully that the idea is that this work won't just be relevant to small island states, but actually where food insecurity is an issue globally, including in the UK, it can contribute methods to research that we're conducting here as well.
And Ruth, I wanted to really expand the kind of question really, and it might seem like an obvious question, but why is evidence and research so important, both to informing public perception and also public policy? Why is the grounding of that work so important, in particularly in influencing issues concerning climate and environment change?
Yeah, thanks, Philippa. So I think the work that the Centre and other people have been doing to evidence the benefits of the environment to human health and well-being has been really important in shifting those policy agendas. And it was really interesting in the context of COVID to see that when we were all in that first lockdown, the one thing we were all allowed to do from a governmental perspective, and which was recognised as absolutely vital for us all, was to get out once a day and exercise in the open air, preferably in our parks. And the value to people of their local green and blue spaces has come into really stark vision, I think, over the last 12 and more months. And similarly, the issues for inequalities of access. So the inequalities of access to quality green space for different communities within our localities, across the UK as a whole and elsewhere, to really recognise that we all need to have the benefits from these green and blue spaces and quality blue spaces. And I think the other thing I'd like to say is that the global pandemic has also shown us what it means to have a global issue that requires global responses. You know, we're not going to be out of the threat of COVID and the various mutations that are happening in one place until we're all protected from those possibilities. So I think it's a real challenge, and also it kind of links to these questions of climate change and what we all need to do to make a difference. This isn't something that can be made different by one part of the world or one government or one local authority making a decision. This is about providing the evidence that allows change at all levels to take place. And the that need and recognition for coordination and a really strong effort. I mean, humans got us into this mess, didn't we? And we're the only way of getting us out of this mess as well. And that means change at every possible level. I think the more we can do to provide evidence that's useful for different organizations, communities, individuals, governments to recognize the problems that we have and to make substantial change to address them, it's really couldn't be more important.
And Laura, really to turn to you for some final thoughts in this area. What I'm hearing is it's not about divisions of policy and department and country. Actually, it's about those connections, and that's something that the Centre has pioneered and championed really since its inception.
So I would say that this discussion, my colleagues, all that you've heard really illustrates what we wanted to create with the European Centre for Environment and Human Health, both in terms of the work we do, the research, the training, the interacting with multiple diverse collaborators in Cornwall and around the world. But also, I think it's a vision of an approach and a culture that we need to hopefully export and grow and learn from. So as Ruth and others have pointed out, it isn't just think globally, act locally, it's also the reverse. And I think it behooves us all to engage going forward.
So I'd just like to conclude really by saying thank you to you all for your time. And I feel we've not necessarily concluded a conversation, but started one. And clearly as part of G7 and part of future conversations, that this debate is going to continue. But I'd like to say thank you for now, and we'll no doubt regroup at another point to continue a conversation further. So thank you.